Imagine waking up one morning and feeling a sharp stabbing pain in your lower back. You think it's just another case of muscle strain, but as the day progresses, the pain worsens. Suddenly, bending over to pick something up becomes a challenge. You try to stretch, thinking it'll help, but instead, the pain shoots down your leg, like a bolt of lightning. It's a pain so intense, it stops you in your tracks. This could be the sign of a slipped disc, something far more serious than just a pulled muscle. The spine, a marvel of engineering, consists of vertebrae stacked one on top of the other, cushioned by discs. These discs act as shock absorbers, allowing flexibility and movement. But when one of them slips out of place or herniates, it can press on nearby nerves, leading to a cascade of symptoms that go beyond just back pain. And here's where things get tricky. Those symptoms can vary widely from person to person. One of the most common symptoms is sciatica, that radiating pain down the leg we just mentioned. This occurs because the slipped disc compresses the sciatic nerve, which runs from the lower back all the way down to the feet. The pain can feel like anything from a dull ache to an electric shock, and it often worsens when sitting, coughing, or sneezing. But here's what many don't realize. Sometimes, the pain isn't in the back at all. You might only feel it in your leg, making it easy to overlook the true cause. Numbness and tingling are another key symptom. When the nerve is compressed, it can lead to sensations of pins and needles, or even a loss of feeling in certain areas, especially in the buttocks, legs, or feet. Some people describe it as if their leg has fallen asleep, but unlike the temporary feeling from sitting awkwardly, this numbness doesn't go away so easily. Weakness is yet another red flag. You might notice that lifting objects, climbing stairs, or even walking becomes difficult. This is because the affected nerve isn't just responsible for sensation, it also controls muscle strength. If the nerve is pinched for too long, it can even lead to permanent damage, making timely intervention crucial. Now, what causes a disc to slip? It can be something as simple as lifting a heavy object incorrectly, twisting your back awkwardly, or it can happen gradually due to wear and tear. Age plays a role too. As we grow older, the discs in our spine lose their flexibility, becoming more prone to damage. The good news? Most cases don't require surgery. In fact, with the right treatment, many people can recover within a few weeks to a few months. Physical therapy is often the first line of defense, focusing on exercises that strengthen the muscles around the spine and improve flexibility. Non-steroidal anti-inflammatory drugs, or NSAIDs, can help manage pain and reduce inflammation. In more severe cases, your doctor might suggest corticosteroid injections to directly target the inflammation around the nerve. But here's a bonus tip you might not hear often: posture matters more than you think. Sitting for long periods, especially with poor posture, can put significant strain on your lower back. If you work at a desk, take breaks to stretch, and consider using a lumbar support cushion. Strengthening your core muscles is another great way to prevent future problems. Simple exercises like planks or bridges can make a huge difference over time. In extreme cases where conservative treatments fail, surgery might be considered. The most common procedure is a discectomy, where the surgeon removes the part of the disc pressing on the nerve. While surgery sounds daunting, it's often highly effective, with many patients experiencing immediate relief. So if you ever feel that sharp, radiating pain, or notice tingling, numbness, or weakness creeping into your legs, don't ignore it. It might be more than just a sore muscle. It could be your body telling you something serious is going on. Seek medical advice early, and remember, with the right care, a slipped disc doesn't have to mean a lifetime of pain.